We have just done a mathematical modeling study to look at the effectiveness of such screening measures. And we say despite the different levels of exit screening in China, the effectiveness of entry screening in European airports is likely to be very, very minimal. So there will be several cases that pass through this system because of the long incubation period of this disease, even with those measures in place. So it's a very ineffective way of trying to contain this disease.
What about what the French are doing? So they've got these planes, they're going to bring people back, like Charles that we just heard about, his case there. That idea of isolating people, putting them in quarantine, is that an effective strategy?
Quarantine is one of the oldest tools in our communicable disease control toolbox. So it is definitely an effective measure. Overnight, we have now got relatively good confirmation in publications in the New England Journal of Medicine and the Lancet of key details of this virus. And we now believe that there's strong evidence that the longest incubation period is 14 days. The efficiency of quarantine measures depends on how clearly can you define the exposure to the virus. Now, we have to remember that these repatriated individuals from Wuhan city, they are healthy individuals. They are not sick people who we're bringing in. They have had some level of exposure potentially to this situation. It depends on whether they have been in contact with a sick person in Wuhan, hospital or healthcare system in Wuhan, to these seafood markets, which likely played a role in the early phases of this epidemic, on how efficient such quarantine measures would be. If you quarantine everybody that you bring in from Wuhan or from China, as we'll probably need to be doing in the future, that's going to be very, very inefficient.